Imagine this scenario. You've got this majestic horse, usually just, thriving out on those lush summer pastures. But then suddenly they start coughing, they're struggling to breathe, and their performance just tanks. It's truly heartbreaking for owners and honestly often really perplexing. For years, we called these kinds of respiratory issues all sorts of things, didn't we? Heaves, RAO, COPD.
No list of names.
Exactly. But now, veterinary science has kind of brought them all together under this one big umbrella term, equine asthma, or EA.
Yeah, and that shift is important. It shows a much more cohesive understanding now. We recognize it's really a spectrum of disease.
Right, a spectrum. And that's what this deep dive is all about. It's for you, whether you're a horse owner just curious about animal health or, love understanding the natural world. We're going to unpack a really specific and often surprising type of EA today, summer pasture-associated equine asthma, SPAA for short.
We'll look at what makes it unique, why it happens, how you can spot it.
And crucially, what we can actually do about it. Get ready, because some of this might really surprise you. It could change how you think about caring for horses in the summer. It's a total perspective shift, honestly. Okay, so let's dig into this spectrum of equine asthma first. When we talk about EA, we're really looking at a range, right? On one end, you have what we used to call inflammatory airway disease.
Now called mild to moderate EA, or MEA.
Exactly. And this is incredibly common. We're talking 60, even up to 100% in some groups, like young racehorses.
Wow, that prevalent.
Yeah. And for you, the owner, the signs can be subtle. Maybe a nagging cough or just that their athletic performance isn't quite there. Often no obvious breathing struggle when they're just resting.
Right, easily missed sometimes.
But then on the other end, you've got severe EA. That's the one historically called heaves or COPD.
And that affects about 10 to 20% of adult horses.
And these guys, they show a really pronounced struggle to breathe, even just standing still. Plus, you see that progressive decline in lung function.
And this is where distinguishing SPAA becomes so critical, because it's different from what we think of as classic asthma, the barn-associated type.
How so?
Well, imagine trying to treat a barn horse by putting them outside more, right? That's standard advice.
Sure.
But for an SPAEA horse, the pasture itself is the problem. That's the fundamental difference. It dictates everything.
Ah, okay. So classic asthma is indoor triggers.
Hmm.
Dust, mold in hay, bedding, that kind of stuff.
Exactly, inside the barn.
Yeah.
But SPAEA is specifically triggered by outdoor allergens. It uniquely affects horses kept out on pasture.
And you mentioned a key clue.
Yes, the seasonal reversal.
Yeah.
This is huge for diagnosis.
Yeah.
Horses with SPAEA typically flare up in the warmer months, late spring, summer, early autumn.
Okay.
But here's the kicker. They often get better when you bring them indoors during that peak summer season.
Which is completely backwards from classic asthma, where they often get worse stabled in winter.
Precisely. That flip-flop is a massive clue for you. We see SPAEA more in hot, humid places like the southeastern U.S., the U.K.
Interesting geographic link.
Yeah. And it tends to show up around age 9, on average. Certain breeds seem more prone to quarter horses, Appaloosas, ponies, that sort of type.
Good to know.
And, importantly, some horses can have a mixed phenotype, sensitive to both barn and pasture allergens.
Oh, that sounds complicated.
It is. Those cases need really careful year-round management that adjusts with the seasons. You have to be flexible.
So it sounds like this silent seasonal assault, but what's actually happening inside the horse's airways, you said it's an allergic reaction.
Fundamentally, yes. It's a hypersensitivity to tiny things floating around outside, especially in warm, humid weather.
Okay, so what are these invisible culprits?
Well, the big ones are pollen from grasses, trees, weeds, peaking late spring through early autumn. They're super small, light, dry, easily inhaled deep down.
Right.
Then you've got molds. They love humid pastures growing in the soil on plants. Aspergillus fumigatus is a common one we see.
Molds.
And just general dust, especially when it's dry and hot and the horses are grazing or exercising, storing things up.
So all this microscopic stuff gets inhaled. Then what?
Then you get this cascade inside the airways. First, a big influx of inflammatory cells. In severe EA, it's mostly neutrophilic inflammation.
Neutrophilic.
Yeah, think of neutrophils as a type of white blood cell. Normally, they fight infection, but here they rush into the airways in huge numbers and actually cause more problems, more inflammation, more blockage. It's a hallmark of severe SPAEA.
Like tiny soldiers causing chaos instead of helping.
Kinda, yeah. Then there's excessive mucus, thick, sticky stuff called mucus hypersecretion that directly blocks the lower airways.
Makes it hard to breathe out.
Exactly. And the airways themselves narrow, that's bronchoconstriction, and they become hyperresponsive, meaning they overreact to even tiny stimuli.
Wow, so it's a multi-pronged attack inside the lungs.
It is. And critically, over the long term, this chronic inflammation leads to something called airway remodeling.
Remodeling, like construction.
Sort of, but not in a good way. It means the actual structure of the airway walls changes. They thicken, they narrow progressively.
And that sounds permanent.
It often can be, especially in long-standing or poorly controlled cases. That's the really scary part. It can lead to irreversible changes.
So the takeaway for listeners is act early.
Absolutely. Timely intervention isn't just about making them feel better now. It's about preventing permanent lung damage down the road. Scarring, thickening, stuff that makes breathing hard forever.
And you called it an invisible threat earlier.
Yes, because these key triggers, these respirable dust particles, are typically less than 5 micrometers. Tiny. You often can't see them at all.
So an owner could think the pasture looks perfectly clean.
Exactly. They might think, my field looks fine, but it's loaded with these microscopic irritants. It really highlights why just looking isn't enough. Education is key.
That makes sense.
And here's another layer. There's some thought that environmental stress on the plants themselves, like drought, might actually make them more allergenic or even produce toxins beyond just more pollen or mold.
Wow, drought making allergies worse.
Well,
That's wild. It
yeah.
really shows how interconnected everything is. Okay, so if you suspect SPAEA, what signs, subtle or not so subtle, should you be watching for? Let's start with the breathing stuff. A frequent cough is a big one, right?
Definitely. It can be wet or dry, come and go, or be persistent, often worse after exercise or being out on pasture.
Okay, and nasal discharge.
Yeah, you might see some, usually clear to cloudy, maybe a bit pus-like if there's a secondary infection, but usually not.
And labored breathing.
Yes, dyspnea. You'll see that increased breathing rate, flared nostrils, and a really noticeable push with their belly muscles when they breathe out, trying to force the air out.
That abdominal effort.
Exactly. In severe cases, you might even hear wheezing without a stethoscope.
Okay, so those are the direct respiratory signs. What else?
Exercise intolerance is huge, really common, and often one of the very first signs you'll notice.
Especially in milder cases.
Yeah, sometimes it's the only complaint in mild to moderate EA. They just can't perform like they used to.
And that heave line.
Ah, yes, the heave line. That's a classic sign of chronic severe asthma. It's this muscular ridge that develops along the side of their belly.
Why does that happen?
It's because those external abdominal oblique muscles get hypertrophied, basically bulked up from constantly being overused to push air out of the lungs.
A visible sign of long-term effort.
Exactly.
Yeah.
You might also see them stand with an arched neck or hold their elbows slightly away from their body, trying to open up the chest. And in really bad cases, weight loss or poor appetite.
But usually no fever.
Correct. Typically no fever unless a secondary bacterial infection complicates things. That's an important distinction.
Okay, got it. So once you see these signs, how do vets actually nail down the diagnosis? Moving from suspicion to confirmation.
It's really a combination approach. You take those characteristic clinical signs we just talked about.
The cough, the breathing effort, the exercise intolerance.
Right. Then you combine that with the horse's history specifically, those seasonal flare-ups linked to being out on pasture.
And the key historical clue.
Seeing clear improvement when the horse is removed from the pasture environment. Like bringing them into a stall, does that help? That's a big piece of the puzzle.
Makes sense. What about tests?
The main diagnostic test, really the gold standard, is a bronchoalveolar lavage, or BAL.
BAL, what does that involve?
A vet carefully washes a small area deep in the lungs with sterile saline and then collects that fluid back. It sounds invasive, but it's generally safe and gives us incredible information.
Like a window into the lungs.
Exactly. We analyze the cells in that fluid. In SPAA, particularly the severe form, we typically see that marked neutrophilic inflammation we mentioned, often over 25% neutrophils in the cell count.
That neutrophil traffic jam.
Yep. We might also see Kirschmann spirals, which are these little spiral-shaped mucus plugs. These objective findings really help confirm the diagnosis and gauge how severe it is.
Okay, so BAL is key. What about allergy testing? People ask about that a lot.
They do. There are two main types.
Yeah.
Blood tests, or serum testing, and skin testing, intradermal testing, or IDT.
Are they useful?
Here's the crucial and often disappointing insight for owners. Serum allergy tests are frequently unreliable. Lots of false positives, false negatives, and they often don't correlate well with the horse's actual symptoms.
So a blood test might say they're allergic to something, but it's not actually causing the asthma.
It happens quite a bit, unfortunately. IDT, the skin testing, is generally considered better for identifying specific hypersensitivities and potentially guiding immunotherapy, like allergy shots. But it has limitations, too.
So neither is perfect for diagnosis.
No, and it's really important to stress this. No single allergy testing method has consistently proven superior for guiding desensitization therapy, and they should not be relied on as the primary way to diagnose equine asthma itself.
So what should owners rely on?
Clinical judgment, that detailed history, the response to environmental changes, and direct airway assessment like the BAL. Those remain paramount.
It sounds like diagnosing the milder cases without the obvious breathing distress at rest must be particularly challenging.
It really is, that subtle poor performance. It's tricky, but catching it early is so vital to prevent those irreversible lung changes later on.
Right, that airway remodeling. Okay, so this brings us to management. How do we actually help these horses? This is where you said it gets really interesting.
Yes, because the cornerstone strategy is often the exact opposite of managing a barn-associated asthmatic horse.
And that cornerstone is...
Environmental management. It is unequivocally, absolutely the most critical part of treatment, period.
more important than meds.
Fundamentally, yes.
Yeah.
Without controlling the environment, medical therapies often just provide temporary symptomatic relief. They mask the problem, they don't fix the underlying trigger exposure, they're palliative, not curative on their own.
Got it. So step one, manage the pasture exposure.
The absolute linchpin. You have to limit the horse's exposure to pastures, especially during those high allergen seasons, late spring, summer, early fall.
And this is the counterintuitive part.
Right. Affected horses should actually be brought indoors during times of high pollen or dust. For severe cases, you might even need an air-conditioned stall.
Which is a total flip from telling owners of barn asthma horses to get them outside more.
Exactly. It's a huge difference in approach. But even when they're indoors, the job isn't done.
Why is that?
Because horses with SPAA might still react to indoor irritants like dust or ammonia, or they could have that mixed phenotype we talked about, sensitive to both environments.
Ah, okay. So you need to optimize the stable environment too. Dust-free everything.
Pretty much.
Yeah.
Dust-free forage is paramount. Soaked hay, steamed hay cubes, pelleted complete feeds. Those are your go-tos.
Is soaking or steaming better?
Steam is generally considered highly effective. Studies show it can kill up to 99% of mold and bacteria, and importantly, it retains more nutrients than soaking, especially prolonged soaking over 30 minutes.
Good tip. And feed from the ground.
Yes, that helps encourage natural airway drainage. For bedding, use low-dust options, dust-extracted shavings, paper, cardboard, pelleted straw. Definitely avoid traditional straw bedding.
Okay. Low dust feed, low dust bedding. What else?
Ventilation. Good airflow is key. And cleanliness, muck out stalls daily. But ideally, do it when the horse is out of the stable. Let the dust settle before they come back in.
Makes sense. What about exercise for these horses?
You might need to reduce the intensity or frequency if they're exercise intolerant. Try to avoid exercising during peak pollen or dust times.
But keep them moving if possible.
Generally, yes. Outdoor exercise away from triggering pastures is often good. If you use an arena, keep the surface damped down to minimize dust. Hydrotherapy, like swimming or water treadmills, can also be a great low-impact option.
Okay, so environment is king, but what role do medications play? They're still used, right?
Oh, absolutely.
Yeah.
Medical therapies are crucial, especially for managing acute flare-ups and controlling that underlying inflammation. But remember, they work best in conjunction with that strict environmental control.
What are the goals of the meds?
Basically, two things. Control the airway inflammation and alleviate the airflow obstruction. Make breathing easier.
So drugs to open the airways.
Exactly. Bronchodilators. They relax the muscles around the airways. Clenbuterol is a common oral one, FDA approved for this.
Yeah.
But horses can become less responsive over time. That's called tachyphylaxis.
The drug stops working as well.
Yeah, and maybe 25% don't respond well from the start. Inhaled albuterol is another option. Works fast but doesn't last very long.
Any others?
There's atropine, given IV. It's very potent, but really reserved for emergency rescue situations due to significant side effects, not for routine use.
Okay. What about tackling the inflammation itself?
That's where corticosteroids come in. They're powerful anti-inflammatories.
Like dexamethasone or prednisolone.
Yes, those are systemic options given IV, IM, or orally. They work well, but you have to be really cautious about the risks.
Risks like?
Laminitis is the big one everyone worries about. Also immune suppression, adrenal suppression. especially risky in horses that are overweight or have underlying metabolic issues like Cushing's or EMS.
So systemic steroids have downsides. Are there alternatives?
Yes, and this is generally preferred for long-term management. Inhaled corticosteroids, drugs like fluticasone, beclomethasone, budesonide.
Delivered via nebulizer or inhaler?
Exactly. The big advantage is you deliver the drug directly to the lungs where it's needed, which minimizes how much gets absorbed into the rest of the body. Much lower risk of those systemic side effects.
That makes a lot of sense. Is budesonide a common one?
It is. It's noted for having a lower risk profile than systemic dexamethasone, and once you invest in the nebulizer system, the drug itself can be relatively cost-effective long-term.
Good to know. Any other treatments people use alongside these?
Definitely. Omega-3 fatty acids are often recommended. They have anti-inflammatory properties.
And flaxseed.
Marine-derived sources, like fish oil or algae containing DHA, are actually thought to be more effective for horses. They can utilize the DHA directly, whereas they're not great at converting the type of omega-3 found in flax.
Ah, better bioavailability.
Precisely. Studies show significant clinical improvement with supplemental DHA. Antioxidants can also be beneficial, helping to combat oxidative stress in the lungs.
Okay, standard meds plus supportive care like omega-3s. Now, you mentioned something cutting edge earlier.
Yes, this is where it gets really exciting, looking at the future. Emerging therapies, specifically immunotherapy using something called CpG-ODN.
CpG-ODN, what is that?
That's a novel approach using these specific DNA sequences. They're immunomodulatory, meaning they influence the immune system. They're administered by inhalation directly into the lungs.
So not like traditional allergy shots.
No, it's different. Think of it like sending a signal to the horse's immune system in the lungs, telling it to calm down its over-the-top inflammatory response.
And does it work?
Early studies are incredibly promising. They're showing significant, sustained improvement in clinical signs, lung function, and crucially, the improvement seems to be allergen-independent.
Allergen-independent, meaning it works regardless of the specific trigger.
That's the idea.
Yeah.
Instead of just blocking one specific reaction, it seems to modulate or re-educate the immune response itself. And importantly, they haven't observed significant side effects, local or systemic.
Wow, that sounds like a potential game changer.
It really could be a
Yeah.
potential paradigm shift, moving beyond just managing symptoms to actually altering the underlying immune dysfunction. It could potentially reduce the long-term need for steroids or bronchodilators.
Yeah.
Still emerging, but very exciting.
Definitely something to watch. Okay, so with all these options, environment, meds, future therapies, what does the long-term picture look like for a horse diagnosed with SPAA? What's the prognosis?
That's a really important question, and honestly, the prognosis is highly variable. It really hinges on a few key things.
Such as?
How severe the disease was when it was first diagnosed, how long it had been going on before intervention, and of course, how well the horse responds to therapy and management.
And severe EA is considered chronic.
Yes, severe EA is a chronic progressive condition. That critical window we talked about is key.
Early diagnosis and management.
Exactly. If you catch and manage mild to moderate asthma before that permanent structural damage, that airway remodeling sets in, the horse can respond really well.
But once the remodeling happens...
Once those irreversible changes are there in the lung tissue in severe asthma, the damage is, unfortunately, largely permanent. Some aspects might be reversible, but the changes to the bronchial smooth muscle often aren't. The lungs lose elasticity.
So the damage limits their future potential, even with good management.
It can, yes. Which brings us back to long-term management and quality of life.
And the number one factor there is?
Consistent, unwavering environmental control. It sounds repetitive, but it's fundamental. Without that rigorous, sustained management, horses with SPAEA tend to just get progressively worse each year.
That's a sobering thought.
It is. And sadly, in some cases, it can progress to the point where humane euthanasia becomes the kindest option. Spontaneous resolution, where it just goes away on its own, is exceedingly rare.
Is there anything else for really severe cases?
Interestingly, yes. For some severe, really difficult to manage cases, geographic relocation has shown the best long-term results.
Moving the horse entirely?
Yes. Moving them to a different climate, often more temperate, drier, continental climates, can sometimes lead to remarkable improvement.
Wow. That really underscores how powerful the environment is. But obviously, that's a huge undertaking for an owner.
Absolutely. Significant practical and economic implications. And finally, we have to remember those horses with the dual phenotype, sensitive to both barn and pasture.
Right, the complex cases.
They require incredibly individualized, flexible management plans that adapt throughout the entire year. It's a constant balancing act.
So wrapping this all up, what's the main takeaway? SPAEA is different.
It's distinct, it's challenging, and it demands a really precise understanding and a dedicated approach from owners and vets.
And it's that reminder, isn't it, that sometimes the best care means doing the exact opposite of what your intuition might tell you, like bringing a horse inside during beautiful summer weather.
Indeed. And that shift in terminology to equine asthma helps us see the bigger picture, the continuum. But knowing the difference between SPAA and barn-associated asthma is
Mhm.
critical because, like you said, the management is often diametrically opposed.
And remembering those subtle signs, like just not performing well, can be early warnings.
Crucial early warnings. Getting that diagnosis early is paramount to try and prevent that irreversible lung damage.
As we finish, here's something to think about. How these tiny, seemingly minor invisible things in the environment, pollen, mold spores, can trigger such huge, progressive biological responses. Not just in horses, but across species, including us humans. This whole deep dive into SPAEA really highlights the hidden power of our surroundings, doesn't it? And how valuable it is to understand those intricate connections for health. It makes you wonder, what other invisible threats might be around us, just waiting to be uncovered?